are drenched in sweat, and it isn't the first time either. Is it the heat, you wonder? But no one else seems to find it that hot. Okay, maybe you're just a little sweatier than usual. Must be nothing. After all, everybody sweats. But what if it is not just the normal sweating? 4 out of 5 of perimenopausal women suffer sudden waves of body heat with sweating and flushing that can last 5 to 10 minutes, often at night as well as during the day. Yes, the hot flushes are here. Starting in perimenopause, hot flushes often continue for a year or 2 after menopause. Different women might experience different levels of heat during these flushes, with some ending up absolutely soaked. Watch this video to understand why you might be experiencing these hot flushes and how you can keep cool through them. Assalamu alaikum and welcome to my channel. If you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revered Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more energy, focus and confidence by following holistic wellness practices that are safe and effective, easy to follow and aligned to our deen. If you are interested in knowing more about perimenopause and menopause, I invite you to attend my free workshop, Hormonal, where I talk extensively about menopause and perimenopause and all the changes your body goes through during this phase of your life. One of my clients, Maria, came to me with hot flushes as a main complaint. Her periods were regular, she had gained some weight, but other than that did not have any other health issues. She actually thought that she was sick with a virus. It was a time of COVID. The hot flushes were not just inconvenient having to change clothes, but they were also very embarrassing. Have you experienced this? You're in a public place and you break out in a sweat and you start looking around to see if anybody else noticed how your clothes are soaking wet. Or you have sweat dripping down your face and neck. So why do you experience hot flushes and what can you do about it? When I taught Maria some of the natural lifestyle measures to deal with hot flushes, she found that they became more manageable. She was contemplating on taking HRT, but she found that she did not actually need to take them. Now, hot flushes typically occur because of decreased estrogen levels. We have an area in the brain called the hypothalamus, which is our body's inbuilt thermostat. When estrogen levels decline, the function of this thermostat can be affected. And sometimes, even when our body temperature is normal, this thermostat can perceive it as being very hot. Now, the coping mechanism of the body when we are very hot is to break out in a sweat. And we are all aware of this, as this happens during the hot summer months. This way, we get rid of the excess heat and the body temperature becomes normal. Now, because this thermostat is not working optimally, you can be in the peak of winter, but your thermostat may falsely think that the body is hot and you break out into a sweat, also called a hot flush. The good news is that this thermostat gradually gets adapted to the low estrogen levels, and over a period of months, it gains back its normal function and it can now tell the temperature better. So hot flushes in most women will get better in a few months' time. What else could it be? If you are in your later years and experience excessive sweating, don't automatically presume that it is because of a hot flush. Make sure that you take your temperature at the time that you have the hot flush. And if your temperature is more or less normal, then the chances are that it could be a hot flush. Sometimes we could be in the middle of a viral illness and we could be sweating because of that. There can be other infections, usually water infections or a chest infection, that can cause sweating. And if you are feeling unwell, then the chances are that you might be having some kind of an infection. A hot flush by itself shouldn't cause you to feel unwell, and your temperature would be, as I said, more or less normal. Not all women experience hot flushes. So what are some of the things that might increase your risk of getting hot flushes? Women who smoke are more likely to experience hot flushes. Women who are heavier and with a higher body mass index are more likely to have hot flushes. It is seen that hot flushes are more in black women as compared to other races, and Asian women tend to have less of them. So how long does it last? Hot flushes can range from 30 seconds, going up to 4 to 5 minutes, and rarely it can last for more than 10 minutes. Some women can have it once in a day, whereas others can have it many times in a single day. They can be mild in the sense that it doesn't affect your everyday activities, or the hot flush can be so severe that you feel that it has taken over your life. When you have a hot flush in the middle of the night, also called night sweats, this can disturb your sleep. And you may have to get up, have a shower, change your clothes, and this can be very disruptive. Let me know if you've experienced this. Now, hot flush is not a disease to be treated. It's generally a self-limiting condition that inshallah will get better in a few months. The question, therefore, that we need to ask is, what can you do to cope better with the hot flushes? So, dress in layers so that you can take off a couple of layers when you start feeling really hot. You can carry a portable fan or a water spray that can help when you have a sudden onset of hot flush. Remember that caffeine can worsen hot flushes, so try and limit that. You may notice that you have more hot flushes if you have spicy food. And if that's the case, maybe you need to cut down the spice in your food. Stress can often exacerbate hot flushes, so make sure you practice some sort of relaxation technique every day, like mindfulness or breath work. If you have never done any kind of breathing exercises, I invite you to check out 2 videos that I've done, one on physiological side and the other on diaphragmatic breathing. If you feel a hot flush coming on, it might help to focus on your breathing and take slow, deep breaths through your belly, also called diaphragmatic breathing, so that it stimulates your vagus nerve and helps reduce stress and calms you down. If you want to learn how to perform belly breathing or diaphragmatic breathing, watch this video. Herbal remedies can also help with hot flushes. Things like evening primrose oil, black cohosh, St. John's wort, and red clover. But remember that natural does not equal to safe. And if you are on any kind of medications or have underlying health conditions, make sure that you check with your doctor before taking any kind of herbal remedies. Make sure you exercise every day. Exercise is known to reduce the intensity and frequency of hot flushes, and it also improves your sleep. Making sure you have a good balanced diet is essential because we know that obesity can increase the risk of hot flushes. Hormone replacement therapy has a role to play in controlling hot flushes. I personally would advise you to take HRT if your hot flushes are of an intensity and frequency that you feel your life is affected by it, and you've tried all these other tips that I've already shared with you, and you think that you haven't got any relief. Now, I do want to be honest with you and have the full picture. In most women, hot flushes will get better within a few months and definitely within 1 to 2 years. However, in up to 10% of women, they can persist for years. Now, we don't know why some women get it for so long. Genetics may have something to do with it, or there may be underlying factors like maybe it may be a side effect of some medication or an overactive thyroid gland. Research suggests that people who have hot flushes may have a higher risk of heart disease and greater bone loss than sisters who don't have hot flushes. Let me share an interesting fact with you. UCL researchers found that hot flushes reduced in about 30% of women as a result of cold water swimming. This research was published in Post-Reproductive Health, surveyed 1,114 women, 785 of which were going through the menopause, to examine the effects of cold water swimming on their health and well-being. The findings were remarkable and showed that menopausal women experienced a significant improvement in anxiety, 46.9%, mood swings in 34.5%, low moods in 31.1%, and hot flushes in 30.3% women as a result of cold water swimming. Now, I know that's a big ask, but there are alternatives to a cold water swim. A cold shower or making wudu with cold water can help as well. If you are experiencing hot flushes, it's likely that you may be having other symptoms of perimenopause like weight gain, period problems, acne. If that is so, I have something for you. But before that, share your thoughts in the comments and don't forget to like, share and subscribe for more discussions on women's health during perimenopause and menopause from a mainstream medicine, holistic and Islamic perspective. If you are experiencing different symptoms of perimenopause, I have created a playlist of the most common symptoms of perimenopause and actionable tips to help with them. Do check them out. Jazakumullah khairan for watching, and inshallah, I will see you in my next video. And remember, your best is yet to come.